You see, when a child has special needs, they need an extraordinary brain. They don't just need a normally functioning brain. They need a brain that actually works on a higher capacity and quality than your healthy child. Because that brain has to either manage and problem solve external stuff, a missing part, longer, bigger, whatever, right? Brachial plaque, you name it, structural, genetics challenges that bring again challenges in terms of the ability of this process to spontaneously take care of itself, basically. So a child is born, it's held, it's nursed, it's loved, it coos, it's changed the diapers, it's taken around, it's put in, it gets a lot of different experiences, it listens to language, but it does its own learning. We do not teach a baby anything. We care for the child. We provide for the child, hopefully, a rich environment emotionally, and contact and speaking and loving and sounds and sights and people and lots of safety. But we don't teach the baby anything. The baby learns. The baby itself, through its own experiences, kinesthetic, the gravitational field, the people, the holding, the positions that happen as a result of it being taken care of, starts sorting the world out. The brain starts forming the patterns, making sense of the different aspects. First and foremost, its own body in its relationship to the gravitational force, to people, and so on and so forth. When we try to teach the baby something, we usually get in the way and we take the risk of creating problems. So babies learn things on their own, but they need the environment. They won't learn anything if you just plop them in a bed and just fed them 3 times a week. And we know that from children in orphanages and things like that. They can die if they don't have enough interaction. But we still don't teach them anything. They learn. When a child has special needs, the special needs means that there is some condition, something is going on that interferes in the spontaneous flow of the child's learning, its ability to learn. It's either external in terms of structure or genetic, or the brain itself has been injured some way, like for instance in utero stroke, where all of a sudden a whole section of the body is overly spastic, doesn't have the normal random movements, doesn't get the information, but now it has half a body that's moving, half a body that's not moving. Try to figure that one out, to roll on the belly. Not easy. If you lay on your back and you made one side of yourself, you immobilized, like contracted your muscles, made them spastic, let the other side, and then try to roll on the belly. Experiment with that one, see how hard it is, and that's when you already know what you're doing, know what to expect, and you've already rolled on your belly. So the likelihood that somebody will figure it out, a baby will figure it out, under those conditions is very, very low. That means that that child needs a brain that's operating extraordinarily well. And what we are doing with the Anat Baniel method, with this technique and approach, is using our understanding and techniques to wake up the brain and facilitate for the brain to work so it can problem solve. That's why we don't do it for the child. We give the child the means and the opportunity to feel and sense and have enough variation and information to problem solve.